that your family is happy, healthy, and whole. I'm grateful for the privilege to be able to share and impart and to conversate with each and every one of you on this night. Would you do me a favor? I want you to tag somebody, text somebody, tell somebody that Pastor Bryant is on and that we're going to be sharing real, raw, and relevant facts about COVID-19 and how it is impacting and if not devastating the African American community. I'm mindful that the Democratic Convention is in hot pursuit even as we speak. And this really ought to be the real agenda for the week. But we've got to keep the main thing the main thing. I see you all climbing in record numbers. And for that, I'm humbled, I'm appreciative, and I'm expectant. Would you please share this as quickly as you can? This is so critical. It's so vital. The Bible gave us a warning label that our people are dying from a lack of knowledge. Our people are dying from a lack of knowledge, and I don't want you to be counted in that number. I don't want you to survive. I want you to thrive. The Master said he came that we might have life, and not a regular life, but to have life more abundantly. COVID-19 is real. People are dying, some 170,000 casualties, some 5 million survivors. And yet this week, just 72, if not 48 hours ago, it was just announced that Georgia now leads the nation in COVID-19 cases. I wanted us to adhere to the admonition that there are wisdom in a number of counselors. And so I brought one of the most forward thinkers and practitioners of healthcare in our community on to share with us on tonight, Dr. Damon Kings. He is, in fact, a healthcare provider par excellence. I'm dizzy and fatigued just reading his bio, servicing over 140,000 patients a year. 140,000 patients a year. He's a graduate of the esteemed Meharry Medical College in Nashville, Tennessee, now calling Atlanta home. I am grateful for him, and all the more impressed that not only is he a doctor, but he is a bona fide musician, having 8 instruments under his belt. He is a virtuoso, and he clearly has been hotboxed from birth to do grand, marvelous, and excellent things. I wanted to have a conversation that I think is necessary between the medical community and the faith community. The marriage between the two. How do we coexist? How do we move our people forward? And so those of you who have questions and concerns about COVID-19, you ought to be on. You got a family member who has been victimized by it. You yourself have been anxious about even being tested, nervous about the vaccine. All of those questions tonight we are going to answer. Let me welcome now our honored guest, Dr. Damon Kings. Welcome, sir.
Welcome. Thank you very much. I'm so excited to be here. Thanks for allowing me to talk with you for a while. Happy to do it.
Oh, no, thank you. This ain't even for them. This is for me. I need you to help me to get through this.
Right.
COVID is so problematic to the faith community
Yes.
because every disease, Doc, that we know about in the Bible comes with signs and evidence.
Right.
And so those who had leprosy because their skin was peeling off, we all know the woman with the issue of blood. We know the blind man.
Right.
But COVID, you can't tell whether you got it.
That's right.
You don't know what is happening. We don't even have a biblical reference for what this is. And so I want you to help just walk us off the ledge, off the Brooklyn Bridge, and talk us down out of anxiety because stress and worry has taken so many of our community hostage. Tell me first, what is COVID?
COVID is a virus. For what we know, from what we know right now, it's related to the SARS virus that maybe you might be familiar with a few years back. So it's similar to stuff we've seen before, but the way it acts is completely different. It's highly contagious. There's aftermath or sequelae after the infection that we don't understand: blood clots, inflammatory diseases, a mental fog. I mean, these are things we just haven't seen. When people get over the flu or other viruses, they're kind of over. This
Wow.
has some lingering effects. But, God is still the same good God he was back in them other days,
Yeah.
And no matter what technology brings or times bring, he is still that God, and he's still going to get us through this. He made us smart. He made us able to figure things out,
Yes.
and so I'm as nervous as people have been. I still remain steadfast in my faith, because it only takes like a mustard seed, right? I mean,
That's right.
I'm sure you teach that. And so,
Yes, sir.
but my thing was, I was going to do my part, I didn't want to sit back. When Georgia opened up as a state and we were out of quarantine, essentially, I said, well, okay, well, what's the plan? What are we doing? Are we testing everybody? What are we doing? And I didn't really hear anything. So I
Right.
didn't wait. I sent a letter to Governor Kemp. I forwarded some information to Keisha Lance Bottoms for Atlanta, and her team was helpful. And I just said, regardless though of who opens the door, I'm going to do what I need to do, and I'm going to touch as many lives as I can.
I appreciate it. I want to, before we go into the call of action, I want you to say a word, and there's several different demographics I want us to address tonight. I need you to say a word about to parents
Yes.
who are nervous. Do I send my kid home? The school systems in many counties are giving an option, hybrid or in person. As a doctor, you are our resident doctor on tonight.
Yes, sir.
What are you advising parents in this season?
Well, I will tell you, I guess when you look at someone and they give you advice, you're going to first ask, well, what are you doing? My kids are not going to school right now. They're doing school online. And I just don't feel comfortable. And I don't feel comfortable for very good reason. There's a little bit of data that, ages 9 and under, the virus supposedly is not as easily transmitted, but we only used about 57 people in that particular study.
Wow.
That's just not enough people to say that this is really how it is. So I don't agree with that. And they said that after 9 and above, then you transmit like adults. So let's say kids, and then there's also other things. So the bottom line to your answer is no. I would not send my kids to school unless there was a plan. And that's the same thing that I felt when we opened the quarantine up. We have to do systematic testing. It has to be regular testing. Our kids have to be obedient. When we say keep a mask on, we mean keep a mask on. When we say wash your hands, wash your hands. And I've been fortunate to have 3 wonderful children that do what I ask them to do. Of course, no one's kids are perfect, and
Right.
I'm sure they don't call daddy and say everything, but they do listen because they know I love them a lot. So right now, I don't feel it's comfortable. I mean, it's time to go back to school other than online learning. And my wife is doing a program where she's going to be giving out tablets to children so that they can go back to school and be able to get online and have their classes. So I'm excited about that. But right now, I would say, no, it's not time to go back until we have a definitive plan. You saw what happened in some of the, I think it was when Cobb County, there were some schools that opened back up, and now they're saying, hey, we got to close back. And we don't want that because the exposure's already done at that point.
I want to ask you the unanswered question or unaddressed issue on CNN, MSNBC, Fox, USA Today, is Black people's subconscious aversion to even the term vaccine. So
right.
I want you to walk us through, as a Black man who is also a doctor.
Yes, sir.
What is your thoughts on vaccine? If Dr. Fauci has a late breaking press conference tomorrow at noon, we found it. Tell us what your thoughts are on it.
Well, one thing, I don't think Dr. Fauci will do that because I've listened to his answers very closely, and I agree with his answers for the most part. And he believes in safety. So we might get a vaccine quickly, but it hasn't had the testing that it needed to see what, one, do we confer immunity once we get the vaccine? That means, does it really work? Are we safe from getting a COVID infection? We don't know if it confers immunity and how long. So we really have to wait on more testing to find out. I will tell you, although I know a lot of our people, especially, are very leery of what they hear from medical practitioners, I'll tell you, I trained at Emory, and I've never met more caring and compassionate people. And I trained in
Wow.
emergency medicine. So I trust our doctors out there because, in general, in terms of doctors, we have a creed. We're to do no harm. We're out here to help people, and we'll sacrifice everything to do that. Our sleep, sometimes our health, and everything. So I think doctors have, their best foot forward, and I think many of our scientists have the same thing. I just think that we cannot rush this until we know that there's safety. So I think it's going to take more time. So what do we do in that time? We wear a mask, we get tested, because we know that works. We know that if me and you were standing in a room and one of us has, well, let's use some other people as examples. Two random people are standing in a room, one of them has COVID and the other one doesn't. What's the chance that other person is going to get it? Less than 5%, because we both have masks on. So right
Wow.
now, our preventative care is really our key. We'll get more and more information on the vaccines as we get more information. Number one is safety. Number two is, does it really work? Does it keep us, from getting
Yeah.
something? Yes, sir.
I want you to help quell the internet chatter of conspiracy theorists. And I
Mhm.
want you to give us your professional opinion as to why there is an inequitable amount of Black people who are contracting COVID.
Okay. So I love when people ask me this question. The reason is not just comorbidities because we have more diabetes or hypertension or asthma. I don't think that's it. What I think is lack of information. And just like you
Mm,
said before, trust. Because, we've had the Tuskegee experiments. We've been
yes.
guinea pigs before. Um, there's just numerous examples of where Black people were not given the fair share. But right now, we have more Black physicians, thanks to Meharry and Howard Medical School and stuff like that. We've had more Black physicians we ever had. And we are out here for you. But it's not just Black physicians. I believe all physicians are really trying their best. So I feel like the main thing is lack of information and lack of contact with medical professionals. If you look at some of the more Black or more African American areas, we don't have the same stores. We don't have the healthy foods available, and we don't have as many physicians. So one of the things we have to do is we have to go seek out care. If you look at
Yes.
cardiac caths, when people have a heart attack, Black people get less cardiac caths. It's a very easy and simple way of fixing the damage from a heart attack, but we just don't get it. We need to make sure we're getting access. Our the mothers and fathers out there, we need to get
Yes.
out there and get the best possible insurance coverage as we can, the best physicians. And that's why I always go to school and work your tail off in school, because we can right these wrongs. Because after a while, these companies are not saying no to finances. So we have to go out and grab what's ours, and that's equal care, medical
I
care.
want you, as a man of faith who is also a physician, to speak to those who are in a rush to go back to church. Uh,
Okay. Okay. No,
tell
I
us,
I get
tell
it.
us what your thoughts are, please.
I get that. Because if we needed communion, if there's never been a time where we needed more communion with others who love God and love Christ, right? So we all want to get together. We want to pray with each other. We want to hug each other. People
Right.
are loving in general, but we can't do it right now. You know, many of our churches aren't set up to be incredibly safe. So if we were to go back to church, it would have to be in a staggered manner where you only have a minimal number of people. We have to set up our ventilation system so there isn't this reuse of air, because the way the virus goes is it's particles, it's respiratory droplets. So we need to be able to clear that. So I don't think we can go back without regular testing at the churches, so if someone's positive. And for those folks out there that are positive, that are afraid to admit they're positive, you know what? Go into quarantine. Be honest. Don't put someone else's life at risk. While you may survive the infection, some other people may not. So I think if we did church where we had, staggered services, where just minimal people there, we had changed the ventilation systems. I think that's something that needs to happen. I think it could be possible, but right now, going back, sitting right next to each other is just that we can't do it.
I'm grateful. On this coming Saturday will be our 7th COVID-19 testing. And I'm just elated that we're able to provide this service to the community, and grateful that you and your wife are spearheading this opportunity for us, with Georgia being ranked #1 in the nation. Would you just appeal to those who live in Atlanta Metro, or those who are in driving distance, what Dr. King called the urgency of now, as to why they need to come join us on Saturday to get tested?
Well, one of the things is we need to be tested. And I just say to the people listening and watching us right now, please, please come out. One of the things you mentioned, the inequities of medicine. One is we just don't take the access, and we're trying to make it as easy as possible. If you go to GeorgiaKnowYourStatus.com, you can register for this Saturday's event. The reason why we want people to register is because we want you to be able to move smoothly through the process, so as many people as needed can get tested. Some folks come out and they say, hey, I hate to sit in the hot sun and wait. Register. We have time slots so that you can get in and get out very quickly. We have a number of people coming out. We make the process easy. We're friendly. We're nice to our folks. We'll be there. But please, no matter what you're doing, you love someone. And this is what I tell people. There's somebody you love. If you love somebody in this world, including yourself, come out and get tested so you can be around that person safely. Get your kids tested. I don't think enough people talk about children being tested. The youngest child, the youngest little baby we tested was 11-month-old. We'll test all ages. We just want to make sure people know. Come out, we're going to make it easy. People say, oh, I don't want to get the nasal swab because it hurts. It doesn't hurt that bad, and it's so useful. So come out and get tested.
And it's so much more comfortable than being connected to a ventilator.
That's absolutely right. Or having shortness of breath, or having chills, or having blood clots form that lead to strokes and heart attacks and stuff like that. It's very easy. If you're positive, stay away from everybody, get quarantined, and keep everybody safe. GeorgiaKnowYourStatus.com/events. You'll see New Birth right there. You can sign right up, pick the spot you want, and we'll make it happen. But at the same time, we don't want to turn away people who may not have access to a computer or something like that. Come on out. We're going to work with you. If we have to stay out, whatever length of time we need to stay out there, we're going to stay there and do whatever we need to do.
Doc, I appreciate you more than you ever know. This is what the work of the church really represents, and what we ought to be doing in servicing the community. And New Birth is proud to be able to partner with somebody of your esteem. Tell me this, completely unrelated. Of your 8 instruments you play, which one do you like the best?
The drums. Yes, sir. I started with the guitar, but in 7th grade, I wanted to play drums. And God is such an amazing God. I didn't have a drum set, right? But I had 2 knees and a pretend air hi-hat and a bass drum with my right foot. Yes. And I went home, listened to some music, and God said, if you can do it in the air, you can do it on the on the set. I ended up winning the drum contest that year. And so that's the other thing. I'm glad you said, people need to realize we have no limits. There is no limits. If you speak something into existence, it's going to happen. God made us in his image. He made us with the power to say something, it'll come to fruition. So I love it. I love the drum. Yes, sir.
You have championed my faith. I played trumpet for 10 years. Yes. And I put it down, and now I'm going to go in my storage and see if I can go find it.
That's right. That's right.
I can dust it back off again.
Yes,
do you still play?
Oh, yeah. I've made about 700 songs or so that I produced just downstairs in my basement. Me and my daughter came out with a song on what you call it? Whatever the Apple iTunes thing. So iTunes called Gonna Win. We did that together. We had some great musicians behind us and other producers behind us, but we did that, me and her. And I don't know, you know that story, the 10 talents. Well, I think
Yes.
God has given me 10 talents, and hopefully when I go see him one day, he'll say, man, I'm so proud of you, because you didn't just sit on it, you did something with everything I've given you.
I appreciate that. Thank you, Doc. Look forward to seeing you Saturday.
Yes,
And
sir.
both of us want to see all of you Saturday morning from 10 until 12. Many of you
right.
are bemoaning. I got tested in May. It's now August.
Yes.
I need
Yes.
you. This is
Yeah.
not the HIV test where you come back a year later.
Right.
You should be getting tested often and
Yes.
frequently. So ask
That's
that you will
right.
please join us on New Birth's parking lot from 10 until 12. Doc said, if y'all keep coming, they're going to stay there. I can't
Yeah.
make you the same promise, but he'll be there
We'll
from
be
10
there till 10 to 2. We're
until
going to be
2.
there.
Okay.
Yes, sir. We'll
From
be
10
there.
until 2. And Doc,
And if we
tell us
need to
again how
stay,
they can register.
yes, sir. It's GeorgiaKnowYourStatus.com/events. You'll see New Birth right there. And you just go ahead and pick your time slot and come on up. Put your information in. If you have insurance, we will see you. If you don't have insurance, that's okay too, because we'll use the CARES Act and we'll get you seen. So we're making it as easy as we can.
I appreciate you. Thank you, sir.
Thank
Enjoy
you.
your evening. Rest up. Saturday, we're going to be here for the long haul.
Absolutely. God
All
bless,
right.
my brother.
God bless you,
Yes, sir.
sir.
Yes, sir.